This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D. or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your life. Now, Health Watch.
It's a beautiful day and a beautiful day to get healthy.
It is, John.
And it's the right time. Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. As always, Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. I'm your host, John DeMasi, and we are ready to talk to you about a variety of issues, all designed to help you and your family improve your quality of life. And we'll do that with Dr. Molly. And if you have a question or a medical challenge that you want to run by her, 855-839-1210 is the number, 855-839-1210 at any time during the course of the show. Feel free to pick up the phone and call Dr. Molly, and she'll try to help you out with whatever your problem happens to be. Good to have you with us as always.
Hey, it's great. Hey, John, may I do a shout-out before
we
begin?
Absolutely.
Because I'm so excited. Everybody knows last week we got a little off track with some of the calls, but one of the callers was Pam, who's been a patient of mine for many years and doing well. And I always talk about the young man and the wonderful son she has. Well, he's just been picked up by a club, and I talk about him, he's a star athlete, he's a great pitcher, and I'm so proud to know him and proud to know his folks. So I just want to say shout out to Shane.
And you have helped him with his journey along the way.
Yeah, of course, in a small way, a very small way. We've got to give credit to the good Lord and to his fine folks. Thank you, John.
Well, you never know. He may pitch for the Phillies one day.
I think he's going to. That's what I said. So I think he's going to. He's on the way, and he's just a great young man.
Well, good luck, Shane, and we hope to see you soon in Philadelphia.
Amen.
Let's start, as we always do, with you kind of explaining what you do, because it's different. So it really bears explanation every week.
I know.
Because people still come in and say, well, what do you do?
Well, I think the best way to know what we do is to come in, John. You know that.
Yeah, right.
And thank you for helping us do that and spreading the word. But we have our like-minded group of providers who actually all work out of my facility, a primary care facility here in New Jersey. And we can do anything that any primary care facility can do, sort of similar to the urgent care that you go in if you have a headache or whatever. We can then, of course, dispense the medication because my wonderful medical directors are great. The healthcare providers are great. My nurses are fabulous. So here we are. We can dispense medication. But what separates us from the pack is that we believe to use the least amount of pharmaceutical to effectuate the medical change that you need, keep you safe, and thereby reducing the side effects, not only from your condition that brings you in, but also from the pharmaceuticals themselves.
We should mention that your doctor, your medical director, Dr.
She's
Pat,
great. Yeah,
was in a condition where she was about to do something else. She was about to give up medicine.
She actually, give up medicine entirely. She gave up very, very lucrative pain management, and she was an excellent anesthesiologist. I mean, glowing review. She's very, very bright, which made her an exact fit for what we do because we use hydration. So she was an anesthesiologist, so she has no fear about the delivery of injectables via hydration. But that being said, when she came into me, she was really in bad shape. While she left, becoming our medical director, which is a testament. And she's not shy about telling that. And this is true for all of the healthcare providers and all of the nurses I have. We really, and myself, we believe in what we do. We actually are patients to our clinic as well. And I think that's a testament to what we do. So again, hydration is the vehicle by which we're able to deliver the natural products in a therapeutic level for each individual patient. And I'm going to go into a little bit more about that as we go through the hour. but it's a very important fundamental principle to realize that when people want to reduce the side effects from their condition and enjoy a quality of life and not have the side effects from the medication. John, you're a prime example of that as well.
Yeah.
You know, you were on certain medications that were doing you in. In fact, that was worse than the condition.
That's right.
And so we were able to help you get off of those in a manner that works. In other words, I tell everybody, please don't get off your pharmaceuticals by yourself. Go back to your physician, tell them the problems you're having, and have them help you get off of these, and maybe occasionally sit in my chair.
In fact, we were talking about Dr. Pat, but also two of your nurses started out as patients.
That's right. That's exactly
so it's like it's a pattern here.
Well, I don't know if it's a pattern, but I think it's a good pattern. And it's a testament to healthcare providers looking beyond the conventional to improve your quality of life. Look, we don't cure cancer. We don't cure autoimmune diseases. We can't cure the uncurable. But we can help a patient enjoy their quality of life, and whatever that is uniquely to that patient. And every day I go in and I'm really in awe of what our patients' expectations are. You know, for some people, it's as simple as going for a walk with their grandkids. For other patients, it's playing pickleball. For other patients, it's, you know, we just want to reduce the medications because I feel so fatigued on the medications themselves. And I have people who are well into their 70s, 80s, and I actually have patients in their 90s, as you know.
We had a patient the other day.
Yeah, he's great.
He came in and he said, "How old do you think I am?"
Oh,
and I said 60. Yeah, okay, I'll take that.
He took it.
91.
And there's a good example of something else we do. For patients like him, he was getting lost in the drama of primary care. He has a skin condition that needed a specific type of medication, and nobody would take the time to help him. They gave him the script. He couldn't fill it because his insurance wasn't paying it. And what we did was we got involved and we advocated for him and we got him the medication he needs, and he comes in to augment the medication. And I can't think of a better story.
Now, you've told us throughout the course of this show, and we've been on for many years now, you've told us that it works.
Yeah.
But what can you tell people? How can you tell new patients that it really does work?
John, the thing I can say is let's talk about the qualitative data as well as quantitative. In other words, do we have statistical information to show people that, for example, in Dr. Pat's condition, I actually have her chart that can show you the improvement she's done in physical exercises and how she's improved, also improving her inflammation markers and other patients. I'm using her as an example because she allows us to use her chart. But there are other things. The young man who's 90 years old plus. We can show people, but the best way to really come in, talk to the patients. There is no way. The group of patients I have, John, you're there every week.
Yeah.
And the group of patients I have, you can't take their minds, okay? They're pretty sharp. They know what's going on politically. You hear the discussions.
Oh, yeah.
They're very astute. And they'll tell you themselves, yeah, I have data from their laboratory work, but sit there and talk to people and find out why they keep coming back, and you'll see.
What conditions, in your opinion, and with facts, of course, what conditions work best?
Well, certainly we've cut our teeth on the cardiovascular conditions. We've seen much improvement in cardiac output for patients who've had congestive heart failure, this type of thing, assuming that they get in early enough. I mean, obviously, if you come in and you're BUN and creatinine, I mean, there's a technique to this. We don't just throw you in the chair, you know, John. We want to make sure you're fit to be able to do it, which separates us from spas. I mean, we want to make sure you're able to take the fluids, that kind of thing. I would say the cardiovascular disease, I think, talk to our cancer patients who've seen changes in their amount of fatigue, the nausea, the kinds of things that really impede their quality of life while they're going through conventional treatment. And then I have a list of people who come in and maybe have autoimmune disorders, which we're going to talk about a little bit today, and we see the improvement in their autoimmune markers, like the inflammation markers go down, the particular blood tests that I'm looking for certain different markers that indicate their condition, and we see changes in that. So again, it depends. You're going to come in, and every patient is different, and every patient has different goals, John.
And you've had many success stories.
I think so.
Yeah,
I think so.
many.
And I think I outline those in my little booklets that people can get on Amazon. But I have to tell you, the most gratifying thing in the world is when a patient comes back to me and to the staff and says, I want you guys to know, they were heading back to Indiana, and they stopped and said, I want you guys to know that Dr. Molly, your staff, Dr. Pat, your staff, everybody, the nurses, we couldn't have been treated better.
And we are coming up on our first break of the morning. The show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. And we always tell you about this time of the show that you should call early because Dr. Molly can take some time and really delve into your situation. 855-839-1210. I mean, last week we had 3 calls at the end of the show. It always works that way. Sure. 855-839-1210. I'm your host, John DeMasi, with Dr. Molly. We both return after these words. Operators are standing by right now at Innovative Medical Associates. 856-489-0505. 856-489-0505. That's the number. And when you call, you really, the best thing you can do is to make an appointment to sit down with Dr. Molly. The initial consultation is complimentary. There you can go over your situation. Dr. Molly can tell you what she can do. It's really very informative. 856-489-0505. That's the number for Innovative Medical Associates. And the website, innovativemedicalassociates.com. Again, innovativemedicalassociates.com is the website. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Let's go to the phones. John is in Mount Laurel. John, good morning. Welcome to Health Watch.
Hey, John.
Hey, how you doing, John and
good.
Dr. Molly?
Hey, good. Hey, John. It's good to hear from you.
I got a call in today from 2 of your nurses.
Oh,
Barbara
good.
and
Yes.
Lana. Happy birthday to both of them.
That's right.
Lana,
That's right.
Barbara's birthday last week. I sang to her. She was coming in. And
Yes.
then Lana's birthday this week. She's taking a day off.
That's
So
right.
happy birthday to both of them, and they're wishing them both the best.
I love them both.
Yeah, they're great. They are. They're a lot of fun, and they're just great people. But the other thing that you continually talk about, the number of times people come in for the infusion. And it's not just the fact that you come in, that it's a specific treatment.
Right.
It's your overall health.
Right.
What it does for you generally. Other things, not you're getting treated for one thing and it benefits others. I mean,
Great point.
I'm starting my 6th year in October.
God bless
I come
you,
every
John.
week.
We're going to have to. We're going to have a big party for you, anniversary. You're a good guy, man. Come on.
Yeah, but I'll tell you, it's what it's done for me. I mean, I haven't had a cold in going on 6 years. I haven't had the flu.
Thank God.
None of that. I mean, my allergies are 99% gone.
Mm-hmm.
And I was getting ready to start a new set of infusions for allergy. I mean, the shots for 5 years I was on them.
Right,
So,
right.
You know, it's not what you come for. It's the side effects of everything else that benefits you.
God bless
That's
you,
right.
John.
I think people have to take that into consideration.
That's right.
Right.
Yeah.
I appreciate that, John.
I walk in and I sit down in your chair, and you right away you're there. You're walking around, John. How you doing? How's everything? And I'll spell something out that's bothering me. Bang! I got a bag of something, and I'm feeling better.
Thank God, John. But you know what? You have the best attitude, right? You have the attitude of a very, very young man, optimistic, and that's what we want to, tell everybody, right?
I am very young.
That's right. That's what I'm saying.
You're a kid.
You're a kid. You're a kid, and that's what we want. That's exactly right, John. And may God bless you and continue to bless your family. God bless you, my friend.
Yeah,
Thanks for the call, John. Thanks for the call.
Great
you
point
know,
he made.
he was saying about other things that it helps.
Yes.
And I mean, my situation.
Well, yeah.
I had a stroke a year ago. It's a year
That's
in
right.
August.
That's right. I know. I remember well.
Yes, we both do. And, you know, a remarkable recovery, as you said.
Thank God.
You know,
Thank
so
God.
And I haven't had a cold either. And I don't remember. I don't remember the last cold I had.
That's right.
So you know, it really does. It helps in things that you don't think about.
You know what it does, John? For the most part, what it does is it starts to improve your own immunological response to things.
Yes.
And therein lies the rub. If you maintain a look, I don't care who we are, me included. We can eat healthy from now to day, right? We can eat healthy. But we're still having to digest these nutrients, these micronutrients. It's the micronutrients and getting them to a therapeutic level that will make the difference. And then you use things like you use repurposed drugs, this kind of thing, to help a patient move forward in their continuum of good health. That's all we're about. It's not holy water. It takes time, John. You know that.
That's right.
And it takes frequency in many cases because most of us, unfortunately, has a lot of stress in our life.
Yep.
Okay, especially in times like now. So, you know, you just don't come in, get a drip, and you'll walk on water. It doesn't work like that.
That's right. 855-839-1210 is our number here in the studio. Last week we talked about this, and we kind of didn't finish this.
Yeah.
We're talking about Parkinson's and degenerative and neuro disorders.
Yes.
So what did you want to say about that?
First of all, I want to tell you that we got a new patient who's starting this week, and this wonderful woman has what they're saying it's a pseudo Parkinson's. You remember me talking about that. You can have tremors, and they can't actually say it's Parkinson's disease. But one of the things I want to talk about was we couldn't get into some of the natural substances, the common natural things that may help. But as luck would have it, this week I read a very interesting article in a alternative medicine journal. It was put out by both NDs, which are naturopathic doctors, and MDs, doing a study on something I used 20 years ago, okay, because I read data on the science of it 20 years ago, and we use it in many things, but a particular form of magnesium. And what they found is that the magnesium would go through the blood-brain barrier, and it helps with nerve cell transmission. Remember I talked about the communication of the cells to each other. That's what makes a difference. So what happens is we use magnesium, and we use magnesium, by the way, in various forms. There are various forms of magnesium, and we use it in a lot of we mediate some other inflammation with magnesium and oxidative stress. So we really use it in conjunction with a number of conditions, but it's how we use a particular form of magnesium for tremors and Parkinson's, I think, that makes the difference. So it was one of the things I wanted to tell people last week and couldn't. And then this week, as God would have it, I see a new article coming out. And actually, John, you and I were talking beforehand about someone who had the surgery where they went into the brain, hit that particular part of the brain to help reduce a friend of yours' tremors. That's done conventionally. But one of the things I'd like to say, and I asked you, I said, did the doctor tell him that it was going to reduce his tremors forever? No. That's right. One of the things I would say is if you have a metabolic condition that is also contributing to this, in other words, it's one thing to go in there and physically change the neuron, the nerve endings, right? Change that, remove tissue, that kind of thing. It's something else to give the body enough of the nutrition necessary to continue that. So people who've had this done, they ought to really think about doing hydration and the nutrition specifically for these neurodegenerative diseases. And I think that they will tend to have better outcomes in the long run. And by the way, they're using laser now also for hitting that portion of the brain. And I actually had a patient who did the laser, went up to the particular institution that was doing it, and is now following it up with our protocol for their hydration.
Does the delivery of magnesium have they studied the reduction of tremors?
Yes, that's it.
And that's where
That's where this specific type of magnesium comes in. But we found that, of course, magnesium comes in various forms, but you can continue to take oral magnesium and never get to that. That's my point. And we're able to deliver a dose that we think is appropriate for the patient. And again, that's going to vary from patient to patient. That's where Dr. Pat and I put our heads together and figure out what are we doing for this. And then we co-partner that with things like coenzyme Q10, vitamin C, your favorite. We use some extracts of certain other vegetables that we use, other vegetables like indole 3-carbinol that we use a lot for cancer patients as well. We're looking at certain omega-3s, vitamin D, a specific form of extract of vitamin D3, and some other things like frankincense and anti-inflammatories. So all of those together, we believe, has better outcome, whether the patient has had the surgery, the laser, or nothing at all.
So it's just the same as you've always said with vitamin C. You can take from the health food store. You can take a couple of pills a day, and it's not going to mean anything, really, for the most part.
No.
So it's the same thing here.
Right, and that's the simplicity of it. The complication comes in as to what form of vitamin C do you use, and I have several. What form of these particular things, and do we use a repurposed medication with this that I talk about all the time, LDN? And the answer to that is yes, and various again. Dosing varies from patient to patient. It isn't the kind of thing where you go in and say, "Hey, give me the drunk tank IV. It's gonna work." It doesn't work like this, and I will tell you that more and more is coming out that medical hydration, and it's always had a place in medicine, always. When people came in and they were dehydrated, the first thing they do is get a sort of a banana bag to get back their vitamins, their minerals, to get them through the day. So, this is something that's been around from the ages. It just isn't done typically.
And that is the cue to we are at the halfway point of the show. Wow. So, boy, it really is flying by today. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number here. 855-839-1210. Dr. Molly Fantasia is here, and I'm your host, John DeMasi. We both return with more of today's Health Watch after these words. We are back here on Health Watch, and as always, operators standing by right now at Innovative Medical Associates. And the number, 856-489-0505, 856-489-0505. When you call, you want to get some information, feel free to do that. Ask them as many questions as you like. But most importantly, you should make the appointment to sit down with Dr. Molly, the initial consultation. It is complimentary, and you will find out a lot about your condition, about how Dr. Molly can help you. It's really a very informative session. 856-489-0505 is the number. And the website, innovativemedicalassociates.com. There's a lot of good stuff on the website. Check that out. Innovativemedicalassociates.com. I get mixed up, Innovativemedicalassociates.com is the website. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. And we have our favorite caller, Frank in the Northeast. Frank?
Our favorite co-host. How are you? How are you, Frank?
I wish I was. I was calling to say, last week I called in requesting 4 things. A first-time caller, the mayor of Germantown, Joe, Pam, congratulations, Shane, and also John the barber. It was 3 out of 4 last week, and John was the first-time caller today. I take that as 4 out of 4, okay?
Oh, man.
Hey,
That's great.
You're batting 1,000.
You're batting 1,000, buddy.
But speaking of batting 1,000, Shane, congratulations, Shane. I also feel he's going to set a record. When he's in MLB now. He's going to set a record for the earliest to have his first no-hitter.
We would like that. That'd be great.
That's all right.
He's a great
and Dr.
kid.
Molly, Just one. I'm making one request today. Let us have 2 first-time callers today. People, you listening? Dr. Molly's the best, coast to coast. Call in. Don't think about it. Call in and ask for a question.
Thank you, Frank. Thank you, Frank.
Hey, congratulations, Pam and Shane, and you made it. Good job, Shane.
God bless him. God bless him. Thank you,
Dr.
Frank.
Thank you, Frank.
That
Thanks
was
for
a
the call.
very sweet call. And let me tell you something. That is really the kind of patients we have, kind of people like Frank. No matter how terrible or how horrible their particular condition is, they look outside and they send out shout-outs to other people. And you know that's true in our facility. People are always worried about their neighbor. And that's what I love about the place. I mean, it's just an incredible...
It's unique.
It's,
that's
yes.
for sure.
It's very unique. It's very unique.
All right, 855-839-1210. That's our number here in the studio. You were talking about Parkinson's, and we were going over this. You were mentioning repurposing drugs.
Yeah,
now,
LDN being one of those.
What are they?
Well, repurposing drugs are drugs that maybe have an indication for a certain use, but physicians throughout the ages have used them quote-unquote off-label. By that it means they were approved, let's say, for diabetes. But today you see that they're using them for weight loss. And there are many others like that. The question becomes, you want to utilize repurposing drugs in a manner, again, that's dosing specific for the patient and will help the patient in their journey or their quest from their condition. So, for example, I use LDN for a lot of autoimmune diseases, and it's one of the things we're going to talk about next. So we use low-dose naltrexone, and naltrexone was out there, to reverse opioids. But it has been repurposed today, and LDN is very popular. However, we use it specifically with the hydration therapy. And why? Because we found that it's so cohesive. It works so well in conjunction with the IV treatments that it has made a huge difference in my patients' outcomes. And again, I told you, I spoke about it a few weeks ago. I was up at a conference for it, and it has become much more popular, but I've found that our patients need it in a way of tincture, this kind of thing, because they're able to utilize it better. Most people can't take oral.
You were saying with Parkinson's that it affects more men than women.
Yeah, in that case, Parkinson's affects more men than women. The next condition I'm going to talk about is autoimmune, and it affects more women than men. I believe there's a hormonal imbalance that goes on regardless in most of these conditions. Can't prove it yet. I'm trying. But there's definitely a hormonal, I think, component in this, and which is why age-related.
So what about autoimmune? What did you want to talk about?
Well, the autoimmune disease I want to talk about today is scleroderma. And we got a call from a patient, a potential patient, who's the wife of a present patient and a friend of the clinic as well. So scleroderma is an autoimmune disease that's connective tissue disease. The connective tissue, the term scleroderma, don't let it fool you. It describes common manifestations that are linked together, hence scleroderma, meaning all over, right? It's hard skin. It means hard skin. It involves abnormal growth of connective tissue that supports the skin, but we forget that also supports the internal organs. People get excited if they see a scleroderma patient who has a skin disorder that it might be contagious. It's not. It occurs when the body's own immune system begins to attack its own healthy cells. Now, we've talked about that before with many conditions. And scleroderma has two sides to this condition. It can be a localized scleroderma, which you would see on the skin, right? So it can spread to the muscles, the joints, and the bones. But the internal organs are not necessarily or typically affected in localized scleroderma. It really becomes systemic. But in systemic scleroderma, and that's what this patient has, who's potentially coming in, it affects connective tissue in all the parts and many parts of the body, which means skin, esophagus, which means what? They have problems swallowing, right? Think about it. Think about it. Lungs, they have problems breathing. Kidneys, they have problems excreting the toxins. Gastrointestinal, digestive, muscles, joints, bones. blood vessels. It's not unusual to see people who have systemic scleroderma have something like Raynaud's syndrome, which means they have cold fingertips and toes, sort of like the diabetics we see, right?
Yeah.
They have, right? And it can affect the heart as well. So, these are the problems. And what we have to look at is that it's not the localized scleroderma. That's when I would love you to come in. Localized scleroderma, we can definitely, the red spots on the hands and the face, ulcers on the fingers and the toes, fatigue. But it's the rest of it. It's the rest of it, the internal organs. So what if you can think of this, John, as scleroderma forming scar tissue on these organs and the blood flow to the extremities. So you really got to look at scleroderma as a pretty terrible conditions. It's interesting. It affects more African American people and Native Americans higher than Caucasians. It has a worse prognosis in individuals 65 or older, a family history of autoimmune connective tissues like lupus, which I see a lot of, right? People who have lupus have a propensity and a risk for developing scleroderma. There are some scientists that believe that environmental triggers and factors may trigger scleroderma. Now, I will tell you, I believe that because I believe these toxic environmental factors trigger many autoimmune diseases because the body's fighting on so many fronts.
You were saying before that the body attacks its own healthy cells.
Yes.
And that's scary. What do you do about that?
Well, one thing I would say is let's get a
Does your hydration help that?
We deliver. What do we do, John? Of course we do. What do we do in situations like this? We have to what? We have to turn out the fire, the body, the fire. We talk about this all the time. So what do we need to do? We need to use anti-inflammatories, right? We use frankincense, which we actually are using boswellic acid. We're using so many anti-inflammatories. Vitamin C has to be used in a case like this, highly antioxidants. We would use some repurposed drugs as well. And again, we might use it in a subclinical dose, but we use them. So the treatment really is going to depend on the symptoms that the patient has when they come in. I mean, the hydration treatment has to vary. One thing we wouldn't use is what? Collagen protein, would we? In scleroderma, because they're making an excess of it. So I go back to the thing I say all the time, and people laugh at me. They laugh when I come in on Monday morning. They say, okay, here comes Goldilocks again. The Goldilocks theory, not too much, not too little. There are times you want to use more collagen, right? There are times you want to use more collagen, but there are other conditions we don't want to do that. So what we want to do is, I'm not telling people to get off of their corticosteroids if the doctor has put them on it, but you want to look at what other types of treatments might be able to help you reduce the amount of the steroidal medicine, because in the end, the steroids, what? They just turn off your autoimmune system and keep you at bay, and it's really not a good thing for long term.
This is really a complicated situation.
It is. And I have to tell you, I had an old friend of mine in college who had scleroderma. She's no longer with us. Wonderful, wonderful person. When you looked at her, you would think she was ageless because the collagen formation on the skin appeared to be very healthy. But what was going on internally was terrible. And it's a terrible way to end your life, because generally they're in wheelchairs, they can't move around, they're having all of these problems with breathing and cardiac, and of course all the GI problems that they had from the very beginning. So there is a real problem with this condition, because sometimes it's really misdiagnosed, and it affects women between the ages of 30 and 50 more likely. And that's what happened with my friend in graduate school, and unfortunately she died probably at the age of 45.
Wow.
So I mean, this is a condition that I don't take lightly. and people who have it shouldn't take it lightly.
Are you able to help people with this?
Yes. For example, we might use some herbal remedies like ashwagandha, ginseng. Okay, we may use those because we want to support optimal stress response. We might use something like a natural cortisol because they use corticosteroids to turn off this. Vitamin C, of course, we want to do. There are many articles out there about this. The conventional treatment, it offers no real solutions. It really just gives the medication to mask the symptoms. I think we have to look at the autoimmune response and really look at what can we do to help a patient really turn their own immune system back to balance or homeostasis. And I think that can only be done by the use of the antioxidants, by the use of certain things, making sure that they're not getting too much collagen. And again, we have to look at the digestive tract. Remember I talked about this in the neurodegenerative diseases. Well, it's also true in this type of condition, which is a degenerative autoimmune disease. You have to look at the digestive tract. People need to be put on probiotics. They need to use enzymes. They really need to look at these kinds of things because scleroderma really affects the nerves that stimulate the bowel. So there are so many things to look at in this condition, John.
We are coming up on our final break of the morning, which means you still have time to call in with a question or a medical challenge for Dr. Molly. 855-839-1210, 855-839-1210. Call and make sure you don't get shut out today. 855-839-1210. It's Health Watch with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. I'm your host, John DeMasi. We both return. More Health Watch after these words. Operator standing by right now at Innovative Medical Associates, and the number 856-489-0505. You can call right now, but if you want to call after 9 o'clock, sure. In fact, you can call all day. Dr. Molly works those operators. They don't go to the beach. 856-48...
Dr. Molly doesn't always go to the beach either. Come
okay. On. All right. For the record, you don't. Yeah. 856-489-0505 is the number. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. And don't forget, we if you missed any of today's show or you want to hear it again, 4 until 5 this afternoon, it's the Health Watch replay right here on Talk Radio 1210 WPHT. We're going to the phones right now. We got Charlie in Philadelphia. Charlie, good morning. Welcome to Health
Charlie.
Watch.
Good morning, sir.
How you doing? I have a rash, and I get it every year at the end of the summer when it's humid.
Whoa.
And it's been worse this year than it's been since I can remember. Some of my legs, down my legs onto my calf a little bit.
Really?
Places on my arm and back, and the doctor says it's tendinous or whatever it's called.
Yeah,
it's like jock itch or something.
Yeah, right.
I've had it for years, and I've did different doctors and different creams and this and that, and I think a skin doctor gave me something to take internally and externally, which seemed to get rid of it for a while, but it's come back.
It's like
and the doctor I'm with now, he just gives me cortisone cream, and it relieves it, but it doesn't kill it, and it's got to be something inside me.
You
like
better believe that. That's exactly.
I was thinking of taking a oil of oregano or something, but I'm afraid that'll kill my stomach bacteria.
Hey, Charlie, you're a very smart guy. That's exactly right. Now, you're right about the oil of oregano. Now, if you came into our facility, I would probably give you a specific hydration protocol that kills off fungus and that type of thing. Systemic, I'm talking about. I can't exactly tell you all about it. Vitamin C is something else you ought to be looking at because it has a propensity to do that. I've
been eating a ton of tomatoes. I love tomatoes this time of year.
Good for you. Well, that's good for your prostate too. So it's a good thing you're doing that.
Maybe acid's bad for me. I don't know.
Yeah, I know. The thing is, I think you ought to be maybe on a better probiotic as well. And maybe take some enzymes with your meals. And it sounds like you know a lot about integrative medicine, so look at some of these things that are antifungal in nature. Problem is, you can't ingest enough of it. All the things you're talking about, Charlie, about upsetting your stomach and that kind of thing, happens. A couple of IVs, you'd be like a new person, I think, and you'd get this thing under control. You got to find the right place. You're a good man. But thank you for the call. That's very interesting, and I know that it's also very annoying. God bless you. Take care, buddy.
Thanks for the call, Charlie.
That was a nice call.
Yeah. Again, the theme is you can't ingest enough.
Right. You can't. He can
over the counter.
It's hard. It's hard to do, John. I just want to wrap up with the scleroderma because I spoke about the esophagus dysfunction and those types of things. You see, the skin hardens. What do you think happens? You have muscle. You lose muscle there, so you can't swallow. Think about that. I spoke about the Raynaud's phenomena. It means like areas of the body feel numb and cold when exposed to cold temperatures. The blood supply is impeded because of the vascular tightness. So this buildup of this fibrous tissue causes the skin to tighten so much, you lose the ability to move your hands, your joints. So this is nothing to take lightly. If you have a patient who has scleroderma, these calcium deposits cause lumps to form under the skin. It's quite unsightly in some areas, and I will tell you again, if you have it, there is some help for your symptomatology. We can't cure the condition. It's autoimmune. It has to be done very, very carefully. But there are things that can help you, including physical therapy. I'm a big believer in that. You've got to take the probiotics, moisturizing the skin with the right type of moisturizer because you don't want more collagen. And then you should try your best to reduce some of the other stressors in your life.
All right, real quick. You had some people from Indiana come in?
Yes,
and
this was a very interesting case. This patient, what we did was we ran a genetic test on her that we swabbed the inside, and this is a test that we have in our facility. We swabbed the inside of her cheek, and we ran the genetics to see what particular antidepressants would work for her depression. And we got back a list. Interestingly enough, her list, the antidepressant she was on the bad side of the list, okay? It had a lot of interactions. What we did was we slowly took her off the antidepressant she was on. We brought in another form of antidepressant in an appropriate dose, not a tremendous dose, because we had to worry about her age. We actually then used a repurposed drug for her sleeping to get her off of the benzoids that she was on, which, by the way, they're terrible drugs. To get off of those, you really need help with. I have another patient right now. He's a wonderful man. He's been detoxing himself off the benzoids for months, and that's the right way to do it. He did work with a psychiatrist. I'm all for working with your psychiatrist, and we actually worked with the counselor in Indiana who is treating this patient for the emotional issues. But she did very well. She left giving everybody a hug, my nurses, everything. She felt so much better.
And now, what is the follow-up?
Well, the follow-up, she'll be back in 3 months. We'll, again, revisit this, make sure that the antidepressant, she has several antidepressants that might work for her, not just the one we put her on. We then keep this in the record. We were able to send it over to her psychiatrist as well to help, again, in the dosing, etc. So there are so many things science are doing right now with genetics. That's why I like to be the DNA doc. And, it really, really helps, and it helps guide us even with the natural substances.
And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators standing by right now, and they'll be there well after we leave you at 9 o'clock. 856-489-0505, 856-489-0505 is the number. Don't forget the website, innovativemedicalassociates.com. innovativemedicalassociates.com. And also, don't forget, you can listen to us again at 4 o'clock this afternoon, the Health Watch replay, 4 until 5, here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Barbara, Donna, Lana, and Vicky, And, of course, there's Fabulous Fran, Joanne, Delightful D, and our medical assistant, Sandra. I'm your host, John DeMasi. Thank you for listening. We'll talk to you next Sunday, 8 until 9. Health Watch here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.